Hi there, I'm Dr. Robert Davis, an emergency surgeon with over 50 years of experience. At 83 years old now, I've had the privilege of meeting many people and helping save a great number of lives. But there are still some patients who remain with me, the ones I couldn't save, the ones who made one small mistake after a meal. Just yesterday, I couldn't help but think about the grandparents in my neighborhood. They were laughing, spending time with their grandchildren, and just enjoying the day. And yet, some of them ended up in the emergency room after making a small mistake following a meal. It really breaks my heart. Now, there's something I need you to remember, something really important. The 30 minutes after a meal are absolutely critical. There are things you should never do during that time. Because, believe me, a tiny misstep could cost you more than you think. One of the most important lessons I've learned over all these years is this. The 30 minutes after eating are a kind of golden hour for older folks. When you eat, your body sends blood to your stomach, and that means less blood for your heart and brain. And during that time, doing the wrong thing could put you in a life-threatening situation. There's one patient I'll never forget, Mr. Frank Williams, 80 years old. He had just finished a delicious meal with his family, and as he was enjoying the moment, he said, "I think I'll take a quick shower now." He went to the bathroom, and within moments he collapsed. Sadly, he passed away from a stroke. Then there was Mrs. Helen Carter, another patient who'd always been so health conscious. She took great care of herself. After dinner, she decided to go for a walk, and that's when tragedy struck. She suffered a heart attack and didn't make it. These things happened in a span of just 30 minutes. Every time I think back to those moments, I feel a deep sadness. I often ask myself why I didn't make sure this message reached more people sooner. But now, you're not in the dark about this. Today, I want to share something with you, the most important lesson I've gathered over my 5 decades of practicing medicine. If you stay with me and watch this video to the end, you'll not only protect your own health, but you'll also help protect your loved ones. So, do me a favor and share this video with anyone who needs to hear this. And don't forget to subscribe to Wisdom Welcome, where I'll keep bringing you more helpful advice for a healthier life. I'm also going to share with you my health notebook today, a guide I've put together from everything I've learned over the years. It contains the 3 most important things you should never do after a meal. Please, for your health and well-being, keep them in mind. Now, have you just enjoyed a delicious meal? If so, I'd like you to listen carefully to what I'm about to say. The 3 things I'm going to talk about today could truly make a difference in your health. The first thing to avoid is a habit of lying down or leaning right after a meal. You might be thinking, what's so wrong with lying down on the sofa after a meal? I get it. I've been there too. After a nice, satisfying meal, it feels great to kick back, relax, and watch a bit of TV. But this habit can actually be more dangerous than you might realize. I remember a patient of mine, Mrs. Evelyn Johnson, who was 74 years old. She lived in a small town in Ohio and had always made a habit of lying down on the couch after eating. One day, after lunch, she reclined and began to feel short of breath. She was rushed to the hospital, and thankfully, they were able to treat her. But the real issue was that stomach acid had moved up into her lungs. causing a serious problem. This is something that becomes even more dangerous as we age, so it's important to keep it in mind. When we stand or sit up straight, our bodies digest food much more efficiently. You see, the stomach is shaped like a vertical pouch, which allows food to naturally move downwards. But what happens when we lie down? The stomach acid has a much easier time flowing back into the esophagus. Now, there's a valve between the stomach and the esophagus called the sphincter, which usually keeps things in place. But as we get older, that valve weakens. So lying down puts extra pressure on that weakened valve, which can lead to heartburn at first, but eventually it can lead to chronic esophagitis or even esophageal cancer. Studies show that around 75% of people who suffer from esophagitis or esophageal cancer have the habit of lying down right after meals. On top of that, when stomach acid rises up into the throat, it can cause respiratory issues like coughing or asthma. Even more concerning, research has found that the habit of lying down after eating can triple your chances of developing pneumonia. This is something we need to take seriously. Now let's talk about something I see people do all the time: jumping straight into housework or doing the dishes right after a meal. It's a common habit, especially for those of us who take care of our homes. You might think, I feel better when I clean up right away, or if I stay active, I won't gain weight. So you dive straight into chores after eating. But here's the thing. After eating, your body needs time to focus on digestion. When you eat, your stomach pulls in a lot of blood to help with the process. But if you immediately start doing dishes or cleaning, that blood gets redirected to your arms and legs instead of staying where it's needed, in your stomach. This can throw off your digestion and put unnecessary strain on your stomach. Worse, your heart and brain might not get enough blood, which can cause dizziness or even a racing heart. I remember a patient of mine, Mrs. Doris Miller, 76, who lives in a small town near Jacksonville, Florida. She'd always been the type to jump up right after meals to clean the kitchen. She used to say, I just can't relax until it's all cleaned up. One day, after lunch, she started washing dishes and suddenly felt dizzy. She lost her balance and fell, badly injuring her knee. She was unable to walk properly for over a year. Mrs. Miller said to me, if I had just taken 30 minutes to sit down after eating, I wouldn't have gotten hurt. I regret it so much. Sadly, this happens to more people than you might think. This isn't just about dishes either. I've seen people strain their backs by lifting heavy laundry or cleaning the bathroom right after eating. But if they had simply taken 30 minutes to rest, those injuries could have been avoided. The dishes will still be there in 30 minutes. But once you injure your knee or back, it's not so easy to bounce back. So, take it easy after you eat. Give yourself that 30-minute break. Your body will thank you in the long run, and you'll keep yourself healthier with this small but important habit. Now, let's talk about taking medicine right after a meal. You've probably heard the advice, it's good to take your medicine after eating. And while there's some truth to that, it's only half right. Some medicines are best taken after a meal, but there's a big difference between taking your medicine right away and waiting 30 minutes after eating. For important medications, like those for high blood pressure, heart conditions, or diabetes, waiting 30 minutes after eating is often safer and more effective. After a meal, your body redirects blood to your stomach to help with digestion. If you take your medicine right away, the medication can mix with the food and the absorption rate drops. Also, because your blood is focused on your stomach during digestion, the medication might not work as effectively. I remember treating a patient, Mr. William Carter, who was 65 years old. He had always been very health conscious and took his blood pressure medication right after meals. But after doing this a few times, he started feeling dizzy. He said, "I didn't expect to feel this dizzy after taking my medicine." This is something that happens to a lot of people. The habit of taking medicine right after eating can put extra strain on your body, and it can lead to unpleasant side effects. Medications play a vital role in our health, and taking them properly is crucial. If you take them at the wrong time, you risk them not working as they should or even causing side effects. For example, medications that affect circulation can lead to dizziness or even low blood pressure symptoms. In fact, studies show that about 15% of seniors over 70 who take their medicine immediately after meals experience falls as a result. This isn't just a statistic, it's a real issue that many people are facing. I also want to share a story about Mrs. Margaret Hill, 74, who lives in a small town in Tennessee. She had always worked hard to take care of her family and thought it was just normal to take her medicine right after eating. One day, after taking her medication immediately after lunch, she suddenly felt lightheaded and dizzy. She lost her balance and fell, injuring her elbow badly. Mrs. Hill said to me, "If I had just waited 30 minutes after eating, this wouldn't have happened." She still regrets that mistake to this day. The truth is, most medications are best taken either 30 minutes after a meal or 30 minutes before. Of course, this can vary depending on the medicine, so it's important to ask your doctor or pharmacist for guidance. When the label says, "Take 30 minutes after eating," it's not just a suggestion. It's a crucial piece of advice for your health. Now that we've covered the risky behaviors, let's talk about the healthy habits you should adopt after a meal. If you stick to these habits, they can go a long way in helping you live a long and healthy life. The first habit is sitting up straight after eating. After a meal, it's best to sit up straight for at least 30 minutes. Sitting with your back straight helps with digestion and can prevent acid reflux. For example, Mr. Henry Adams, who lives in a small town in Georgia, always had the habit of lying down right after meals. As a result, he suffered from gastritis and acid reflux, and he was on medication all the time. He couldn't sleep well because of the burning sensation in his chest every night. But recently, he started sitting up properly for 30 minutes after meals, and now he's able to stay healthy without relying on stomach medicine. Mr. Adams said, "I never thought such a simple change could make such a big difference. Why didn't I know this earlier?" It just goes to show that even small changes can make a big impact on your health. The second habit is drinking lukewarm water slowly. About 10 minutes after eating, try drinking a glass of lukewarm water slowly. Avoid very cold or hot drinks, as they can disrupt digestion. Mr. Charles Roberts, who lives in a suburb of Chicago, had always struggled with heartburn. But after he started drinking lukewarm water after meals, his heartburn completely disappeared. He said, I didn't know how important a glass of water could be. Now, I've made it a habit to wait 30 minutes after eating and then drink warm water. It's a simple habit that can lead to a remarkable change. The third habit is going for a walk after eating. About 30 minutes after a meal, it's good to take a 15-minute walk at a comfortable pace. Avoid walking too fast or engaging in intense exercise, but just a gentle stroll. For instance, Mrs. Eleanor Turner, who lives in a neighborhood near Portland, Oregon, developed the habit of walking around her apartment complex 30 minutes after meals. As a result, she was able to cut her diabetes medication dosage in half, and she lost 10 pounds. Mrs. Turner said, "I never imagined that walking after meals could make such a difference. I feel lighter, and my blood sugar levels have stabilized." Just like Mrs. Turner, simple activities like walking can make a huge improvement in your health. These are the good habits to follow after meals. If you stick to these simple practices, your health can improve in ways you wouldn't expect. Start implementing them today. Lastly, I'd like to offer some special advice for those who live alone. If you're eating alone, it's even more important to pay attention to your post-meal care. Sometimes, after eating, you might suddenly feel unwell or have discomfort, so it's crucial to keep your phone nearby and be ready to call for help if needed. Additionally, it's good to spend at least an hour after meals talking to someone or engaging with others. When you live alone, having a conversation helps reduce feelings of isolation and ensures that you can get help quickly in case of an emergency. For example, Mrs. Betty Williams, who lives alone in New York, always makes it a point to talk to her daughter or a neighbor for at least 10 minutes after each meal. She shared with me, "After eating, when I call someone, I feel less lonely and much more comfortable. Last year, when I suddenly felt dizzy after a meal, I was able to get help quickly because I was on the phone with my daughter." This simple habit can make a huge difference, and it's something many people don't realize could be life-saving in an emergency. Even if you live alone, it's really important to connect with someone after meals, especially in environments where it's easy to feel isolated. Regular communication with others can do wonders for your mental and physical health. Taking care of your health isn't about doing everything alone. It starts by sharing with those around you. Now that you understand the importance of post-meal care, remember the 3 things you shouldn't do and the healthy habits you should practice. What I've learned after 50 years as a doctor is that health doesn't come from big efforts or grand changes, but from small habits that build up over time. If you stick with the things you've learned today, I'm confident you can live a long and healthy life. I hope this video has been helpful to you and your loved ones. For a healthier and happier future, start practicing these habits today. In the next video, I'll share even more health tips. Please remember to subscribe and like the video. Thank you.